Before Yuki left for vacation, he sat down with a local expert on Lyme disease about a tiny danger that could become a big problem if it is left untreated.
Well, nicer weather means more time outdoors, and that means a greater chance of meeting one of those tiny but dangerous bugs. We're talking about ticks, and here to talk about ticks and the dangers of Lyme disease is Dr. Garabedian of the Garabedian Clinic in affiliation with the Holtorf Medical Group in King of Prussia. Dr. G, nice to see you.
Nice
welcome.
To see you.
Welcome. First of all, how do you get it? How do you get it? Before we went on the show, you talked about there are a variety of ways really to get it now, but most people think ticks. First of all, how do you get it?
Well, traditionally, the Lyme bacteria, which is the Borrelia, is carried through tick bites because they live into the ticks and they're carried through them. But we know recently that ticks are not the only vectors for Lyme disease.
What else?
There are a high percentage of them that get it through mosquitoes. There are even in recent studies that showed that even gnats could carry them.
Gnats?
Yes.
Gnats and mosquitoes are everywhere.
Exactly. And that's why a high percentage of these people who come to my office would say, but I never got a tick bite.
Wow.
So why would I get Lyme?
Well, we say not every gnat, not every mosquito.
Not every.
Right, okay.
So that explains the other versions of that.
What are the symptoms? Let's talk about early symptoms, later symptoms, and so forth.
Lyme disease is a very serious illness. Although its onset is usually so insidious, so general. Sometimes it's a general aching, sometimes it's a little bit of headaches, sometimes it's feeling fatigued. All these vague symptoms that the person would get. Occasionally there is that target rash that they talk about.
Yeah, that bullseye.
People refer to it as bullseye rash, although about 25% of the people would get that rash only. Not everyone gets it, and some of them are not even close to the area of the bite, which makes it a bit more difficult to diagnose, if you want.
I see.
And since the symptoms are so vague, unless the person has been previously bit by a tick and is concerned and goes to his doctor saying, I got bit by a tick, the physician might never even think Lyme.
What are some of the lingering effects?
Well, if nobody treats Lyme, if you don't treat the disease usually can start to get worsening in symptoms.
Gotcha.
So now you have enlarged lymph nodes, you have joint involvements, you have central nervous system involvements. People start to develop even emotional or psychological symptoms. You can develop paralysis of the face, facial paralysis. You can develop tingling, numbness in symptom areas of the body. All those become more and more symptoms as the disease is progressing if untreated.
Just about out of time, you've been successful in treating this, correct?
Well, we have been successful in treating it because we are now more successful in finding out about Lyme.
Very good.
Just about recently, a test was discovered to culture Lyme. Lyme was a very difficult bacteria to culture. It wasn't available to be cultured outside the body, thus there was no such a thing. Now there is a Lyme culture test that was just developed a couple of months ago, and we utilize that to detect any active infections of Lyme, which is a very good way of doing it.
To you and your colleagues, we say thank you. Keep doing your thing. Thank you, Dr. G. Appreciate it.
Thank you.
For more on Lyme disease and the Holtorf Medical Center, just go to cbsphilly.com and click on Talk Philly.